I'm Dr. Amanda Wright, and I started Harmony Health Direct Primary Care in Moore, Oklahoma in March of 2021. So as of the making of this video, I've been open about 1 month. I thought it would be interesting to see this perspective of a brand new DPC doctor in clinic. And I think it'll also be fun for me to look back on this in a year or two and see how far I've come and how much has happened since then. So my first question is, what is the hardest thing you had to do as a DPC doctor? So far, the hardest thing I've had to do was just make the commitment and the decision to leave what I was doing to do DPC. So I was employed in a hospital system. I had, a paycheck and a retirement and paid vacation and people to deal with the angry patients for me. And so leaving that known for the relative unknown of starting my own clinic is, a hard decision to make, but I knew that I couldn't continue to do what I was doing, and I knew that I had to make a change. So I think that it was the right choice, and I'm happy that I did it, even though it was hard. So question number 2, if you were not a doctor, what would you be and why? I have always thought that it would be fun to be a high school science teacher. I know teenagers can be challenging, but I think they're at such a neat time in their life when they really crave guidance and care and love from the people that are around them, the adults that are around them. And so I think it would be fun to have that kind of impact on kids in their adolescence and teenage years. Plus, I've always loved science, and they get to do cool experiments and dissect things, which I've always thought was fun. So I think a high school science teacher. Question 3, what is the most embarrassing thing you did as a medical student? So I'm sure there were several, but the one that really stands out to me is I was third-year student on my rotations, and I was in some clinic inside the VA hospital in Oklahoma City. And I started to not feel well, so I went to the hallway and sat down, and then I proceeded to pass out and hit my head on the tile floor. And then some nurses saw me, and everyone insisted that I go to the ER as I had been injured in the VA hospital. So they had to wheel me down to the ER, and I'm trying to hide my face and hope nobody that I know sees me, no other med students or residents or attending. And then I had to go to the ER and get a CT of my head, and my entire family showed up at the ER at the VA, and I just wanted to be out of there, so hopefully I wouldn't see anybody that I knew because I was embarrassed. So everything turned out fine. Turns out it was a panic attack that had caused me to pass out. I was not injured and everything was fine. But third-year medical students are always trying to avoid, at least I was always trying to avoid too much attention on myself. So that was not a good day for me. So thank you for listening and watching, and it's been fun to be on this DPC in 3 segment. Thank you.